now had your consultation, and I'd like to go over some treatment plan options with you. Everyone interested in hair restoration surgery usually has two goals. They want more hair, and they want it to look as thick and as natural as possible. But part of our evaluation is to assess what your needs are and desires and match that to your hair characteristics and what your donor supply is like. So the first thing we're going to do is evaluate your donor supply. And frequently we will use a video microscope which magnifies the area, because we want to assess several things. We want to look at your hair density, which is the spacing between the hairs, and also the density of your hair bundles, because hairs typically grow in groupings of 1 to 4 hairs. And we want to see what your hair quality is like in terms of how fine your hair is, whether it's coarse, whether it's straight or curly, because all of those are factors which determine how your hair transplant results were going to be. So let's look at your hairline and some of the thought process behind how we design a hairline. So the first thing is, frequently the younger you are, the more hair you need, because most of your contemporaries have more hair or less hair loss. But it's really important that we design a hairline that's not only going to meet your needs now, but as you age, will age gracefully with you. So one of my rules of thumb is that the younger you come to see me, the more conservative I am with your hairline. The second is, hairline's kind of a misnomer. In fact, when we design a hairline, we want it to look as natural as possible, and we want to avoid a line. So part of what we do in the hairline is create irregularity. We want to put single hairs in the very front and gradually add 2, 3, and 4 hair groupings behind that to add density and yet maintain the natural appearance. There is some preparation prior to your hair transplant procedure, and each hair transplant surgeon will have their own set of instructions to give you prior to the procedure. But in general, this is an outpatient procedure, so most physicians will want you to have breakfast that day. Some will ask you to keep your hair a little longer because it's easier for some doctors to work with, and some will suggest that whatever length you have it at now is fine. Certainly there's some medications that you may want to avoid if you're taking it, and they usually have to do with blood thinners like aspirin, ibuprofen, Advil. There's a whole host of other medications that may thin the blood, and even some over-the-counter vitamins may also have that quality.